Dermatology Associates and Surgery Center.
And welcome back, viewers. I'm Shay Paul, and I'm here in the studio with Alex Epperly, physician assistant with Dermatology Associates and Surgery Centers. And you're at the location in Charleston. I always like to say that.
Yes.
Alex, with temperatures rising out there, I know a lot of patients come in to see you, maybe with skin cancer concerns, wanting you to do an examination.
Correct.
What other conditions do you see this time of year?
So we see many different conditions, but one that is very common is called hyperhidrosis. Hyperhidrosis meaning it is an increase in sweating, and so it's common for patients to have increased sweating of the face, the underarms, the palms, and the feet. And a lot of times patients are embarrassed. There's barriers for seeking treatment, but it can definitely affect their quality of life. Increased sweating when they go to shake someone's hand, or when they're writing with a pen, or even opening a doorknob can be difficult for patients. But it is very treatable, and we have many different treatments that we can use for those patients. Some of them are topical medications that we have them apply at home. Some of them are treatments that we can do in the office, and some are, there's a new FDA-approved treatment for axillary hyperhidrosis that we can recommend as well.
Exactly?
So it is, they actually destroy the sweat glands in the axilla, and so it's a permanent solution that we can offer patients as well.
Wow, what is the downtime for a procedure like that?
So the downtime of that, it varies. That's normally a procedure that we refer patients to a surgical center for that.
Okay, so the other treatments that you mentioned would be the less invasive.
Correct, the less invasive. We have topical medications. There's a new topical wipe that was actually just approved for hyperhidrosis, and then there are also oral medications that we can give for patients that will help their sweating throughout their body.
Now, do you see this this condition more in men, or is it pretty equally divided?
I think it's pretty equally divided. I mean, there are definitely certain conditions that can bring out hyperhidrosis. So patients, if they're anxious or nervous, they can sweat. But a lot of times patients will notice it when they're not having any activity. They're just sitting still, and they can see kind of the sweat perspire and drip off of their body. That's one of the signs that we look for. They're sweating when they're stationary, just sitting still.
I see.
Yeah.
Now, if any of our viewers may think that they have this condition, would like to schedule a consultation, where can they find you?
So we have multiple offices throughout West Virginia. So I am in the Charleston location, but we also have an office in Hurricane. We have an office in Beckley, Princeton, Logan, Martinsburg, and Hagerstown.
I see. Okay. Well, very good.
Yeah.
Well, that's great information as always, and I appreciate you being here with us today.
Thank you so much for having me.
And we'll be right back.